America's biggest health insurer, UnitedHealth, just confirmed it's facing a massive federal investigation. We're talking criminal and civil probes into how they bill Medicare. This news sent their stock tumbling, dropping about 4% in just one day, and it's already down over 40% this year. Why? Because the government thinks they've been playing games with patient diagnoses to rake in bigger payments. And the full story? That's what I'm diving into right now. And the biggest surprise is coming at the very end. You do not want to miss this. So, what exactly is going on? The Department of Justice, our federal cops, are looking into UnitedHealth's Medicare Advantage program. Think of Medicare Advantage as private versions of the government's Medicare plans, mostly for folks over 65. UnitedHealth runs the largest of these, serving over 8 million people. It's a huge business for them, bringing in $139 billion in sales last year alone. But here's the catch. The government pays these private insurers based on how sick their patients seem. The sicker the patient, the bigger the payout. This is officially called risk adjustment coding. The feds are investigating if UnitedHealth improperly boosted patient diagnoses, essentially making patients seem sicker on paper to get more money from Uncle Sam. They're looking at things like their House Calls program, where nurses visit Medicare patients at home. The company allegedly used special tools like a diagnosis cart to suggest conditions that could lead to higher payments. We're talking specific, complicated health conditions like artery disease or a rare hormonal disorder. Sources even say some diagnoses were added without the treating doctor confirming them. These in-home assessments reportedly triggered an average of about $2,700 in added federal payments per visit. This isn't just a minor squabble. It's about potentially getting billions of extra dollars from taxpayers. The government is actively asking former employees if they felt pressured to add these diagnoses, indicating they're serious about finding out if this was a deliberate scheme. The implications of these accusations are enormous. If a company can inflate diagnoses, it means the system is being exploited, and that affects everyone, especially American taxpayers who fund Medicare. It could mean less money for legitimate healthcare needs elsewhere. This isn't just about numbers on a spreadsheet, it's about the integrity of a crucial public program. Keep watching, because the company's response and how they've handled this bombshell is truly something else. Here's the wild part. UnitedHealth had been denying these federal probes for months. Back in May, when reports started flying that the Justice Department was looking into possible Medicare fraud, UnitedHealth flat out called those reports deeply irresponsible. But now they've admitted it. They've started complying with both criminal and civil requests from the feds. They say they proactively reached out to the Justice Department after seeing media reports about the investigations, trying to get ahead of it. This sudden change in stance is a massive shift. This isn't their only headache. This past year has been a total mess for UnitedHealth. First, their CEO, Brian Thompson, was tragically shot and killed in New York. This sparked a national outcry about how insurance companies treat people, with many pointing fingers at care denials. Then, their next CEO, Andrew Whitty, suddenly stepped down in May, leaving investors scratching their heads and adding to the company's instability. Finally, they completely pulled their entire money outlook for the year, stopping all financial predictions because their medical costs were soaring higher than expected. This news alone sent their stock plunging about 22% in one single day. Their stock has been absolutely hammered, losing over 40% of its value this year, and it's down about 55% from its all-time high of over $630. This makes them one of the worst performers on the S&P 500 this year. With a total company value of about $265 billion, losing half of that is a catastrophic blow. Despite all this, UnitedHealth is trying to project confidence. They've stated they have full confidence in their practices and are committed to working cooperatively with the Justice Department. They even point to independent audits by the government's own Centers for Medicare and Medicaid Services that they claim confirm their billing methods are among the most accurate in the industry. They also mentioned a previous decade-long legal battle over their Medicare Advantage business, where an independent expert found no evidence of wrongdoing. To show they're serious, they've even launched their own third-party reviews of how they code patient health, manage care, and handle drug services, expecting to wrap that up by the end of this fall. But does any of this actually make things better, or is it just damage control? We're about to uncover the wider implications this has for the market and every American. And trust me, you'll want to stick around for the shocking final detail I promised at the end of this video. So, what does this ongoing federal investigation mean for UnitedHealth and for you if you're an American taxpayer or on Medicare? This probe adds another layer of huge uncertainty. UnitedHealth's Medicare Advantage segment is its biggest moneymaker, pulling in that $139 billion in sales. Any hit to its integrity or profitability here is a massive blow. Analysts mostly say it's a moderate buy right now, with a target price of about $356, suggesting it could jump by about 24%. Even company insiders have been buying shares, sensing a deal. But the risk is high. If the government finds him guilty, we could be looking at fines easily in the billions of dollars. Think about it. UnitedHealth's profit per person on a Medicare Advantage member is about double what they make on a regular person's insurance. That's why there are billions of dollars flowing through this program, making it a huge target for federal scrutiny. The Justice Department is actively questioning former employees and doctors about whether they felt pressured to boost diagnoses. This kind of scrutiny isn't just about UnitedHealth, it's shining a spotlight on the entire private Medicare industry. These private plans now cover over half of all Medicare beneficiaries, and they're costing the government an estimated $84 billion more this year than traditional Medicare. Regulators and lawmakers are getting serious about potential overbilling and claims of restricting care for seniors. This could lead to huge fines for UnitedHealth, major damage to their reputation, changes in how Medicare Advantage plans are paid, potentially reducing their massive profitability, stricter rules for all private Medicare plans, affecting what you pay and what services are covered. This could impact millions of Americans directly. The investor dilemma is real. Do you buy the dip on a fundamentally strong company that's now cheap, or do you run from the overwhelming regulatory risk and leadership instability? The company will be answering tough questions on this during their earnings call next week, so expect more headlines soon. This isn't just a corporate drama, it's a bellwether for the entire healthcare system. And now for the final, most crucial piece of information that ties all of this together. Here's the kicker, the most shocking detail that puts all of this into perspective. Despite all of UnitedHealth's defenses and their claims of accuracy, the federal government isn't just looking for mistakes in billing. They're looking for criminal and civil fraud. This means they suspect deliberate intent to inflate diagnoses for profit. This isn't just about an accidental error here or there. It's about whether there was a systematic plan to game the system. The fact that UnitedHealth is now cooperating with criminal and civil requests after months of denying any criminal probe shows just how serious this has become. It's like a giant game of Monopoly, but with real people's health and billions of taxpayer dollars. The government is making it clear they're not playing around. They believe they have enough information to pursue a case that could prove the company knowingly misrepresented patient conditions. This investigation is a massive shakeup, not just for UnitedHealth, but for the entire American healthcare system. It's a wake-up call for how private insurers operate within our public programs. The outcome of this probe could redefine how Medicare Advantage plans are structured and regulated moving forward, potentially setting new standards for transparency and accountability across the entire industry. It's a battle over who truly benefits from the system, and the stakes couldn't be higher for millions of Americans and the future of Medicare. If you found this breakdown helpful, then don't just sit there, smash that like button. Make sure you subscribe to the channel for more direct, no-nonsense financial insights that cut through the noise. And definitely hit the bell icon so you don't miss any of my future videos. Thanks for watching, and I'll see you in the next one.